In this video, we'll talk about how to document the history of present illness before a procedure period. If the patient is presenting for an average risk colon cancer screening examination, you can double click on this or single click on the area where you get a gray marker for the history of present illness, and then this box opens up on the right hand side. You can double click on this one that says average risk colonoscopy, open access or direct access, and this short verbiage appears with a single click. The other option would be to use something like this, which would open up a bigger panel, and over here it auto-populates the patient's age and gender, and you can pick the reason for the procedure. In this case, if it's average risk, we're going to say age, and we're going to say no symptoms and no prior colonoscopy, and save. What then happens is all of the other things will get cleaned out when you finish the report. If you want to see what the final output would look like, you can hit this cleanup button, and this is how it would ultimately show after the note has been processed. Of course, for now, we'll undo this part over here so that everything else also shows up. Now, if this patient is presenting for evaluation of symptoms and the patient has been seen in the office before, I would recommend that you click on this that says recent office visit. And if you double click on this verbiage shows up over here. Now, if you get your cursor, which essentially states that the patient is here and here's a summary of their last visit. Now, at this point, if you click on this part right after the recent HPI and go down here, you can then see what was done on the last office visit. Now, if the patient was seen in the office visit before and has been seen multiple times, you will see several of these notes, and you can pick the one that you want to go with. And if you double click on this area, this part then automatically makes its way over here. And then you can proceed, and this should satisfy all the requirements of the HPI. Thanks.